Hi, I'm Diane McKay. I'm a clinical psychologist and I work in Sarasota, Florida, and I specialize in working with folks who are dealing with weight management issues or eating disorders. Well, eating disorders often start with really good intentions. Somebody decides that they would like to eat healthier. Maybe they want to start eating more organic food or go vegetarian. Or just be making sure that they're eating a healthier diet in general. Or they want to lose a few pounds, exercise a little bit more. And those good intentions start off with people being able to lose a few pounds, look better, feel better. People start noticing, complimenting them, and then the cycle starts to begin. The thoughts don't go away and they realize, wait a minute, everybody thinks I'm looking good. Maybe I should lose a few more pounds. And then this nasty cycle begins where you can't stop thinking about body image and weight and food. And one thing leads to another, and the next thing you know, you've lost more weight than you should have, or you're not as healthy as you anticipated from these eating habits, or worse yet, you don't even know that it's happened. Other people are telling you this, but because you feel so much better, you're not noticing it. A couple of quick things that really start to present. And you start to refuse to eat certain kinds of foods, start creating rules about food. I only eat this in this situation, or I don't eat that kind of meat, I only eat this kind. Or I've even seen people become really specific with their rules. I only eat foods that are round or green, that kind of thing. Or they'll only eat foods that so-and-so cooks, or that they have control over what goes in and out of it. So that's part of that. Refusing to eat in public, refusing to eat in front of other family members, or having to have some kind of control over the calories, the type of food, who cooks it, who presents it, how it's presented, that kind of thing. And then there's signs that concentration becomes difficult because you become so obsessed with the food preparation, the food presentation, as well as weight and body image issues, that all of these thoughts start to become primary in your mind, and that becomes an obstacle to being able to think and concentrate about other things. There's also a tendency for folks who have eating disorders to have either histories of thinking in perfectionistic ways, or just in general tend to be more perfectionistic, very high-driven, very ambitious. They typically will have either a low body weight if you're talking about anorexia, or oftentimes they don't have a low body weight. But they're typically very thin, or they have a low body fat, and that's not necessarily always in our best interests. They may also have stopped having a menstrual cycle or had some kind of irregularity in their cycle, but they can't tell that that's happened anymore because they've been prescribed a birth control pill, which actually regulates it, and so it kind of gives you the disguise of what's really going on with your cycle. And then sometimes you'll see that there's a family history of eating disorder or weight management problems in the family. Well, the simplest thing is ask your doctor. The downside to that is not all physicians or even therapists or psychologists are familiar with eating disorders at the level that they probably need to be. So if you think you have an eating disorder, you need to seek out an eating disorder specialist who really does understand it and can help you figure out if you do have an eating disorder or you're at risk for having an eating disorder, what do you need to do to fix that? So if you do think that you have one of these symptoms, or possibly are at risk for having an eating disorder, or you think you do have an eating disorder, I would definitely reach out to a clinical psychologist or someone who has an eating disorder specialty and find out for sure.